Inverted nipple is a condition we describe as the nipple being retracted inward. Whatever the underlying cause may be, the core problem is it is specifically due to the milk ducts under the nipple being short. The fact that the milk ducts under the nipple are short, it can be present from birth or emerge developmentally. At the same time, it may arise from an infection. Since infections in the milk ducts cause them to shorten, the nipple is pulled inward and becomes inverted. And although rare, tumoral lesions originating from the milk ducts can also cause nipple inversion. These are the primary causes. The methods we apply for treating this inverted nipple issue depend on the patient's exam results. In some patients, specifically, it can be treated by drawing the nipple out with vacuum application alone. Having the patient use the vacuum for a period will be sufficient to resolve this issue. This vacuum is usually used frequently by women during the breastfeeding period. Vacuums used to extract milk during breastfeeding can also be used for this treatment. However, moving one step further, in situations where simple vacuum aspiration is no longer sufficient, what actions do we take? The next step essentially refers to a situation where the problem is not very severe. With local anesthesia, only the area around the nipple is numbed and the milk ducts are slightly stiffened. And by sliding tiny tissues or flaps inside the milk ducts to hold the nipple up and out, we can solve this permanently. This treatment alternative does not cause any problems for patients' future breastfeeding. However, for those further along, meaning when we try to pull the nipple out with vacuum, pressure, or during surgery, and it still does not come out in very advanced cases, then we are forced to completely detach the milk ducts under the nipple. We must cut and separate it from the nipple. To treat this problem, we slide neighboring tissues or flaps into that area to ensure our treatment is permanent. However, in very advanced stages, it is highly probable that issues with breastfeeding will arise. For that reason, the patient's age and social status are among the most important criteria that will affect our treatment choice. Our basic philosophy here is to minimize risk for patients who plan to breastfeed, and secondly, to achieve a permanent and beautiful aesthetic result. And to get a beautiful aesthetic result, however, I want you to know this. In situations where the nipple is retracted in the inverted nipple condition, we can comfortably and successfully resolve your issue.